Okay, welcome to this month's Midwestern University Physical Therapy Institute live stream. This month we're with a different topic, which we'll talk about here in a second. Before I get into that, I wanted to let you all know if you have any questions along the way, don't hesitate to put those in the chat. We'd love to answer any questions you have live as we're chatting here. If something you hear is a little different than what you've heard from other folks, we're happy to entertain some of that discussion. I want to introduce myself. My name is Dr. Mark Kargela. I'm a physical therapist of 20 years. I practice out of our Physical Therapy Institute here in Glendale. My specialization is orthopedics and chronic pain. I like to focus also on the spine. So that's me. What about you, Tom?
Same sort of position here in our Downers Grove campus. Physical therapist for the most part, a little bit of teaching, a little bit of research. I am a orthopedic specialist like yourself. I'm ready to talk about posture.
Yes, and that is where we will go today. It's one of the more common discussions we have with patients, and it's interesting. Every patient that comes in is like, you're going to talk to me about my posture, right? And they have all these like preconceived like beliefs that there's this, very significant component of posture, which it can be. We're going to hopefully get into the nuance of the posture discussion, because as with everything, it's kind of it depends, and there is no one size fits all recommendation when it comes to posture. So what we're talking about this month is that the best posture is probably your next posture. Tom, can you get into a little bit of like how we were trained as physical therapists and kind of the general cultural beliefs around posture that kind of linger out there that, again, aren't necessarily bad, but they might not really meet the mark of what we now know with research and what we see with science about posture?
Yeah, I do feel like the pendulum is sort of swung sort of different directions as we've been educated doing this 20 years to where we're sort of approaching posture now. A lot of our training looked at symmetry, right? How high is this compared to that? What's the angle of this neck relative to your shoulder blade to this, to that? And you're sort of looking at a static single image picture of symmetry. And a lot of our treatments targeted getting someone in the right posture, not necessarily alignment, because that indicates, spinal alignment, but the right position and posture. And I feel like over the years, it's switched over to this idea is that there isn't just gold standard of posture. You can't just print a picture for someone and be like, you need to do this. You need to be a plumb line from your head down through your shoulders, down through your hips, down through your ankles, because humans aren't symmetrical. We're different bodies made up of different sort of mechanics and anatomy, and it's just we're not symmetrical species. So the achievement of symmetry is really shouldn't be the goal. It should be to address the mechanical or pathology. And if that involves modifying someone's position, then so be it. So the big thing that we've swung towards, in my opinion, is exactly what that title was. It's not about what's the perfect posture. It's about maybe making multiple changes throughout the day, not being stuck in one position all day. Our bodies crave movement, our spine especially. I mean, it responds so well to just movement and any movement-based exercise. So to tell someone they need to be like this all day operating, it's just not healthy. They need to have that nutrition, that sort of nutritional pump that occurs with movement and contraction of muscles and all this. And so the best posture at this point we tend to go for is, as we said, the next posture, finding safe ways to give people opportunities to be in different positions. Not to linger too hard, but one great example, and I don't know if you use this as well, but if someone has generalized low back pain and they're standing at their sink, I often recommend putting one foot on a stool to unload one side and then switch your foot and unload the other side. And it's not because unloading a foot necessarily creates a better less pressure in the spine. It's just the change in position really is something the body likes to feel. So next posture. You want to be going into safe positions, not being stuck like this all day in one position. This is not healthy either.
Yeah. Usually when I see somebody in the waiting room rigidly into that position, it usually gives me some clues that maybe that's part of the issue. We were talking before we went live today is a lot of our chronic pain patients have been given a lot of information of this perfect position and that's only safe to be and this only safe way to move and position ourselves, which really limits their abilities to vary their postures and take advantage of the movement benefits of, like you said, kind of some of the nutritional benefits of helping our tissues stay healthy and mobile when we move them more frequently. Yet And I also will freely admit, I used to put people, I joke and tell patients, I used to put them in movement jail. Like, you had to be in this perfect position. You referenced the plumb line. That was how we were trained, right? Everybody had to be from the eardrum over the shoulder, over the hips, over the feet, and that there was this ideal posture. Yet just go to the shopping mall or the grocery store and watch the variable positions of people, and the variable shapes and postures and positions they're in. And granted, some of them might have pain, but there's just not a lot of data and research to strengthen the thought that if your lordosis in your neck is straight, that you're going to have pain. A lot of studies show that happens naturally as we age, and that a lot of those folks don't have pain. Same thing with increased curves or decreased curves of your low back. There's no studies that show that if you have that, you're going to have pain. No, there might be some times where that might impact the experience, and we can kind of help people position differently. And that's usually an exploratory thing with the patient. It's not this rule you must ascribe to. Everybody's unique. Everybody's different. Everybody has different factors in their life and their work and their demands. So yeah, being flexible to the unique person in front of us, and being flexible to a position and not being rigid, because rigid usually equals tension, which we're going to talk about as far as how that can become a problem when we're constantly trying to ascribe to this mythical perfect posture. One thing we wanted to talk about too, Tom, and I know you work with this with some of your patients, is the whole discussion around ergonomics. Because ergonomics can definitely incorporate postural thoughts, where we're trying to tell people how to position themselves in relation to their workstation, be it a workstation with a computer, or be it even with other, industrial settings where we're helping, workers be a little bit more cognizant of how they're moving and positioning themselves. Can you speak to a little bit of how you kind of utilize ergonomic thoughts in your practice?
Yeah, absolutely. I do want to reinforce one thing that you were getting at as well, is that we are talking about if there's an extreme position, someone's posture that someone's in, that could be detrimental. Think of someone with a major forward head posture. They can't quite get their jaw in the right place. They have this now, and they're having all sorts of pain. That might be something that we have to physically address and correct, because the center of gravity is way over, the base of support and all this fancy stuff, but it doesn't mean it equals a perfect posture for everyone. So, but that being said, yeah, ergonomics, I mean, certainly it's stuff I talk about. Let's use an example of a runner who comes into you with lateral foot pain. Okay. And they're running around their neighborhood, and the road is slightly tilted like this, and they run the same route 6 times a week, and they're doing the same pattern of movement and positioning on that foot. It may be a matter of, well, run the other way. Let's try to even that out. That example to me is like someone who has neck pain, but yet their monitor is offset to the right, but their keyboard's here. And so they're turned all day to the right, or whatever the case may be. So ergonomics sometimes is just finding the desk setup that counters maybe the painful positions that they have presenting in the clinic. But there are some general things we really like to see. I mean, one of the most common ones is that people have their monitors too high and too far away. That's usually the biggest one for me. And if it's too far away and too high, you put yourself in a position where your head comes really far forward and extended up all day. So it's not about finding the perfect posture, but you want it comfortable. You don't want to be straining to get to it. And some of that may be because they needed an updated prescription of glasses. So they're squinting and they're leaning and they're creating more excessive stress. Doesn't mean that this position's bad for you, but this position all day, every day, probably not great, because you're not modifying it. So the ergonomic training I do every once in a while, I have people bring in pictures of their desk setup or whatever. And if I can correlate it to their symptoms, we'll try to make some changes and then retest. And did that help? Yes or no? And then we'll go from there.
Yeah, sounds like a reasonable approach. And, there's definitely been the missing piece of ergonomics. I've had patients where, man, we could make them feel so good with their neck and their radicular pain into their arm, or their low back and the radicular pain into their leg, and could not figure out why they'd come back the next visit. And the pain would return, and what the heck's going on? And felt like we were doing well in the clinic. And then as you start exploring some things, I remember a recent patient where I was like, well, what are you doing with your workstation? Well, I'm on a laptop and I sit with my legs crossed, crisscross applesauce with it in my lap. And I'm peering down at my laptop for 6 to 8 hours a day. So there is no position, be it a perfect posture or an extreme of that position, that is going to be helpful when you're holding it that long. And I agree. I think there are times where postural forces influence. If people are in extremes of stress and strain And especially if we show them that when we get away from that strain, the tissues feel better, they move better, it's pretty common sense that maybe that position isn't going to be helpful for folks. But ergonomics can be helpful. The whole keyboard mouse relationship too, as far as how far people are reaching, just like Tom said, if the monitor is way too far away, sometimes people with bifocals where they're peering through the bottom of their glasses, that sometimes can affect things as well. So having the ability to adapt those things. And if you're not certain, that's where a physical therapist can definitely help you out. As far as I'll often have people, I can't always leave the office, or rarely can I leave the office and go to somebody's workplace. We do have physical therapists that can, but we have, the nice thing is the lovely smartphones now. We can have colleagues take pictures of people while they're at their desk and give people, some good ergonomic training. So you don't necessarily need a full in-office visit. Now, some people might work in industries and companies where there's a on-site ergonomic specialist who can help people out, which is great. It's awesome when we have those resources, but a lot of our patients don't necessarily have that. So physical therapists can nicely step into that role.
I think you said something spot on too, is sometimes it's not about the exact position you're put in, but if you're doing that for 10, 12 hours and not taking breaks and not changing your position, finding that next posture or getting up and walking around or whatever, that's where it's going to lead to problems. I don't care how good of a desk setup you have. If you're sitting at that desk in one position for 12 hours, it's not going to be comfortable. So in the least, so, changing it, setting an alarm, putting an extension on your browser that every hour it says, hey, stand up 2 minutes. That's not gimmicky. These watches that tell us to stand up, yeah, it seems a little gimmicky, but it's forcing us to move. It's forcing us to change our position and not be in a static, plain spot for hours at a time.
Good points. Steve asked a question: how does posture affect sleep, and is there an ideal sleep posture? I'll start, and then I'll definitely be interested to hear your perspective, Tom. There again, the answer always is it depends. Like a posture, I'm not aware of any research or any data that says there's a particular posture that's more conducive to sleep. I'm happy if somebody points out something that I'm not aware of, but and as far as an ideal sleep posture, it depends on the condition, right? Some patients might have conditions where certain positions of their neck, like sometimes I'll have patients where they're just hypersensitive. They're coming off of an acute, maybe it's a herniated disc in their neck, where we might help them position with where they're not really loading it in a very aggressive way, where they're maybe avoiding laying on a side that tends to shoot the pain down their arm, pillowing appropriately. Often I try to help people just find a neutral position, be it their low back and their neck, so they're not putting any stress in any direction. Or if there is a straining sensitive direction, we might temporarily have them kind of position away from it just to unload and help tissues get a little bit more comfortable so we can sleep. We all know that when we are unslept and in pain, it makes pain extra worse and there's actually some significant data that when we're underslept, that our immune system's in a more pro-inflammatory state. So it does tend to make things more sensitive. But where are your thoughts falling when it comes to sleep postures, Tom?
Yeah, my first approach is, okay, what's most comfortable for this person? Stomach, side, back. There's some talk about laying on your stomach forces too much rotation of your neck. I personally sleep on my stomach, like the way I describe, like I'm outlined in chalk, my head to the side, one arm up, one leg up. But I get the most restful sleep that way. It feels great for me. I don't recommend that for everyone. It really just depends on where the comfort exists. I think from a physiologic and anatomical thing, you could probably make an argument that laying on your side generally, helps with your airway. It helps with circulation. It helps keeping your neck more in neutral if you have the proper pillow. So there may be some evidence there, but it really is patient specific. If someone is used to sleeping on their back, and I'm not going to try to tell them to sleep on their stomach now. We'll find other ways to get that position throughout the day, but we don't need to be disrupting sleep any more than it probably is. Pillow, I think, is an important one. Not that there's like the best pillow, but finding, as you mentioned, sort of a neutral position for the neck, because what we'll find is a lot of people, if they have neck pain, their pillow if they're laying on this side, if it's too high, it's going to push their head way too far that way. If it's too low, it's going to bring it too far that way. So again, patient specific, trying to figure that out. But I've had patients that have spent hundreds and hundreds on pillows, still unable to find the right one. So it is quite a lucrative industry. Go into the pillow industry, maybe.
Oh yeah, I've had patients with literally thousands of dollars spent on beds and pillows and all sorts of things to alter sleep posture.
I mean, I don't blame them, but it's so individualized. There's not one global recommendation.
And there are no shortage of bed manufacturers and pillow manufacturers who will promise blissful, pain-free sleep. And I think, again, you can get away with pretty much your Costco brand or your Walmart brand pillow. There's varieties of different firmness in there and make it fit you. But maybe that's my opinion. But maybe the pillow manufacturer would be mad at me for saying that. But
I do recommend a pillow between the knees a lot if you're on your side.
Yeah, especially sometimes low back and hips don't like to be kind of dropping the knee forward, especially if there's acute like nerve root things for a low back. If you have like acute sciatica, sometimes that pillow between the knees or a sensitive hip joint sometimes just likes, excuse me, some support with the pillow between the knees. Last thing I wanted to talk about is we kind of spoke to this a bit already, and hopefully this makes kind of sense. But especially I work with a lot of folks with chronic neck, back, and various areas of chronic pain, decades of pain at times. And oftentimes, and the research supports this, that these folks often carry more tension. Like when we look at EMG studies to see, well, what differentiates some people that don't have neck or back pain from people that have back or neck pain. And the people with back or neck pain are often much more rigid and tight. They've developed a lot more protective, braced, tense movement patterns, and posture is one of those. And again, I mentioned it earlier, but when I see somebody in the waiting room and they're like, looks like they're visibly actively engaged in posture, that just makes me a clue that there's something we want to discuss and unpack. What's their thoughts behind it? Why do they feel like they need to hold that position? There might be, of course, good reason for it, but sometimes the treatment that often is most helpful, not everybody, but for some, is to let go of all this rigid rules and beliefs that there's one specific position that if they don't hold it, they're going to be in danger of the disc going wrong in their neck or their back. There's just a lot of scary information out there around posture and what it'll do to your back. And that's something where we allow patients to validate that view, because it's understandable based on a lot of the scary information out there, and then help them clinically to explore some abilities to try to move out of those rules, and not me lecturing them, telling them that's better. Let their body get the opportunity to tell them that, hey, if you stop this fight and this tension to be in this perfect position, that maybe things might go in a different direction than where they've been going the last 5, 10, 15 years. And that's a hard change for a lot of folks, because there's been just a lot of rules around posture. And I have had people who've recited list upon list of all the things they can't do that aren't safe and are dangerous for them, that aren't founded in any danger or in any significant research, that are founded on a lot of maybe traditional old school ways of looking at posture and pain. That when it comes to posture, it should be relaxed. It should be free, and it should be something that, as we mentioned, you vary up. It shouldn't be a hugely effortful activity for somebody. Anything that you have to add to that, Tom?
No, I think that's summed up quite well. I mean, it really boils down to things we've said with probably every single talk we've had, is that movement is good. And it's really not about holding yourself in one static position, but allowing movement. Give that body, those joints, those muscles, the nutrition they crave by creating this movement and varying that throughout the day. So yeah, I think that's really it. I mean, if a therapist is analyzing someone's posture and they know what they're doing, they're not just looking at just for the hell of it, but they're kind of looking at it from how does it maybe correlate to the other exam things that I'm going to be looking at. So if you have a shoulder blade that's way winging and they're having these issues, that indicates to you as a clinician to go, I need to investigate X, Y, and Z. But the idea isn't that, oh, I need to get them into the perfect posture. It's really just a gateway into understanding them as a body than anything else. But yeah, movement good, sloth bad.
Yeah, exactly. And this belief that human beings need to be some rigid, symmetrical stack of blocks, that if they're not in perfect symmetry, they're going to be at risk for all sorts of problems. And I used to tell people that, but again, the research and science has been pretty strongly pointing out, and our anatomist colleagues, even here at the college at Midwestern, kind of say, well, human beings aren't symmetrical people. We're all different, and we all have unique symmetry things that are asymmetrical, and that's okay. I think what's not okay is when we create fear and scare people about it, and then they adapt a lot of protected, fearful ways of moving that sometimes can perpetuate a lot of this chronic pain things when people are.
And a good word to describe what you're talking about too, about not holding yourself here all day, is the best thing humans. And I was recently in a conversation about this with other therapists at a course, and the best thing the human body can do is be efficient. And you can't be efficient if you're just engaged like this all the time. You can't be efficient in movement and life and whatever. So we're designed for efficiency, not for just one position. Yeah. And I think, yeah.
One of the kind of things we'll do with patients is just, clench the fist and try to move your wrist like hard, clench, and then just let it relax. And which one feels easier? Which one feels better on your wrist? Which one? Yet around the back and neck especially, we've adapted all these rules of you got to tense the core and be tight and be in this perfect position, and then you're clenching the fist all day. That's exhausting for a lot of people, and that's just something that sometimes giving people the freedom to get out of this movement jail that, again, I've unfortunately probably put people in before I understood a lot of the current science and things around pain and posture, that now once that freedom's there, it can really open up some windows for people to move and feel a lot better. Anything else you want to add, Tom, before we wrap it up this week?
No, I think we've kind of summarized just the general idea of it is, keep varying it, keep moving. There might be some specific things related to your posture that can be changed to your benefit, but it's not about maintaining the gold standard plumb line posture all day for, 24 hours. That's not realistic or healthy.
Yeah, couldn't agree more. And if you have questions or if you're not sure, there's definitely physical therapists out there. If you're here close to Glendale or Downers Grove, we'd be happy to help you kind of see how posture might fit into your unique picture, because it isn't a one size fits all. It is, and it depends. And I think rigid rules are often will get people in trouble. So definitely don't hesitate to reach out to Midwestern PTI or PT Institutes. If you have any questions, or your local physical therapist, they can definitely help you in that pursuit and help you kind of move a little bit more with freedom and less pain, which is what it's all about. So wanted to thank you all for joining us this month on the stream. If there's anything else you'd love to hear us talk about, don't hesitate to put a comment in there of any topics you'd like to hear us discuss, and we'll do that maybe next month. But we'll leave it there. Hope you all have a good rest of your week. We'll talk to you next month.
Thanks.